Dr. Damien Korean.
You got it.
That's it, all right? Got you. And he's chief of cardiology at Harlem Hospital Center. And our conversation is going to be a very important topic. And this is the myths and misconceptions of heart disease. And that's it, all right?
You said it, yeah.
Got you. So to start the show off, as always, we always wanted to recite Harlem Hospital Center Community Needs Assessment 2013. It's about to be updated. But, Central Harlem, East Harlem is one of those areas where out of all the 5 boroughs, heart disease is its highest. And I always want to throw those statistics out. I like to do scare factors sometimes. But Dr. Korean, can you kind of explain why the statistics are still kind of sort of high in this area? Is it changing? Is it moving? Is it getting lower? Can you explain to us a little bit?
Yeah, from the last data we have, which is earlier this millennium, we feel the statistics are getting better. But I think what we're going to need to talk about, an extremely important topic, of course, but is the different risk factors which lead to heart disease, and there are a few of them. So if we go through them one by one, I think it'll give us kind of a good sense about why in certain areas we do see more heart disease, we see more deaths from heart disease, we see more premature deaths from heart disease, and we can start talking about those risks. But a lot of those risk factors, major risk factors, are more prevalent in East and Central Harlem for certain than compared to Manhattan and the rest of New York City. Yes.
And is it still that heart disease is still high in African Americans, I believe,
absolutely,
opposed to other ethnic races at all?
Yeah, absolutely. There's environmental and genetic factors for that. It's a complicated issue. It's not straightforward. We're going to come up with a quick answer to answer that question. But there are a lot of factors for that, and we can get into some of those. Sure.
Yeah. So we might as well go into the first risk factor.
Right,
what is that?
Well, we could talk about high blood pressure maybe, because high blood pressure is extremely common in African Americans. It's extremely common in everybody, and it's a risk factor that comes on as we get older. It is almost always completely asymptomatic, meaning you can have very high blood pressure and not know it. The only way you'd know it is to get a checkup and have somebody check your blood pressure. So that's a very important point. I wanted to lead into something that you might have very high blood pressure, not know it, and the only way you'd know it is if you saw your healthcare provider, doctor. So, getting in for a checkup for that type of reason is very important.
Right. So I just wanted to ask, just to let the public know, what exactly is the normal blood pressure?
These numbers are taken arbitrarily, but we have to kind of create numbers. But 120/80 kind of classically was always normal, and anything over 130, the top number is called systolic, the bottom number is called diastolic. So anything over 130, anything over 90 we call high blood pressure or hypertension. But those numbers are kind of taken arbitrarily just to define people having high blood pressure.
And my thing is that I could be wrong, but in Harlem Hospital's outpatient clinic, do they have a high blood pressure or hypertension type registry because it is so high and prevalent in this area?
We do. We very closely follow people with high blood pressure, and it's really a coordinated effort. I mean, the patients mainly will see the primary care doctors. They will come to see us, the cardiologists, if it's very high or difficult to control. And they also see the kidney doctors because really your kidneys are what control your blood pressure. So a lot of these patients end up seeing the kidney doctors for that. But yeah, we keep close track of all of them as a registry.
Okay. So the next question. The next risk factor.
I want to mention, and I think it'll come up over and over again, is smoking. And, smoking, cigarettes should be banned, period. If you see some of the damage that cigarettes do to people, I'm not talking about cancer or other things or even lung disease, just the damage it does to people's blood vessels leading to heart attacks and strokes and heart failure is just unbelievable. So, people smoke. It's difficult to get people to quit smoking. We do have new therapies to help people quit smoking. Counseling helps. There are new medications to get people to quit. We do have a smoking cessation clinic at Harlem Hospital, and that's, I would say, the number one modifiable risk factor for heart disease in this community, in our community, and really in the United States. So extremely important.
So let's talk about, we talk about myths and misconceptions.
Sure.
You hear out there that if you smoke the electronic cigarettes opposed to smoking the tobacco,
Yes.
that it's less dangerous.
Mhm.
Myth or fact?
Wow, that was, Sean, you hit me with a great one right there. This is going to be tough. First of all, personally, I feel anything smoking instead of a cigarette is better than the cigarette. So I'm actually a fan of these electronic cigarettes. But there is some debate because that vapor you inhale, while it's not smoke, it's not something burned, there may be some substance in that vapor that we don't know about. It's not just water. So it is preferable to cigarettes. If I have a smoker and they want to try electronic cigarettes, I absolutely recommend it. Another concern is, they're easy to get. Maybe people will start using electronic cigarettes who were not smoking at all, so that's an issue and maybe a problem. But it is the smoke that's the problem. It's not the nicotine, that's in cigarettes or electronic cigarettes that causes the heart disease. It's a bunch of toxins that's in the smoke. So if you can get rid of the smoke, you can get rid of the heart disease. So me personally, yes, on e-cigarettes, but it is still controversial. I don't think we'll come up with an answer. I would say if you smoke, I would recommend you give e-cigarettes a try. If you've never smoked, of course, I would not touch either of them.
So if you had a choice between the e-cigarette and the patch,
Mm-hmm.
what would you say go with?
I would say the patch. You can try the patch. It's not that successful. That will give you the nicotine. There is some danger if you have the patch on and you smoke at the same time. You can get almost overdosed on nicotine, so you have to be careful with that. But I would say the patch first, and then if that doesn't work, I would try the e-cigarettes.
All right, so getting into another risk factor, what do you think about high cholesterol?
Very important. There's a lot of debate about it. Sean, you know as much about it as me, probably more. And I want to say something too. There's so much data out there in the lay press. People read newspapers about dietary guidelines changing. This is good, this is not good. And I think we're as much to blame as the non-medical people in terms of giving a confusing message out there. Is what we do know for sure. Saturated fat is bad for you, and saturated fat causes heart disease and vascular disease. This is really indisputable in my mind. And mainly we get saturated fat from animal products, meat and dairy products. And, there are some conflicting data. Dietary studies are hard to do because it's not like giving somebody a pill and saying, okay, you take this pill, you don't. People who eat a certain way, they tend to exercise a certain way. Maybe they don't smoke so much. So I know last couple of years there were some studies that came out in the New York Times about dairy intake with the saturated fat associated. Maybe wasn't so good, but it was criticized because maybe people who drink milk tend to be healthier people and they exercise more. So there's a lot of confounding risk factors. So what we really know, though, again, to repeat, is that saturated fat is bad for you in terms of causing heart attacks and strokes. That's really indisputable. Salt, if you have heart disease, a lot of salt is bad for you. But even that is controversial somewhat. But I think that's kind of indisputable. If you do have heart disease, if you do have heart failure, that salt is bad for you. How much they're working on. High salt foods tend to be not healthy foods, processed foods. So just another thing, looking out to avoid. So just personally, I'm a vegetarian. I want to throw that out. Yes, and so I am biased with some things, of course, but I've done a lot of reading on it, and you can do your own literature search and internet search on the topic, and certain things are very clear like that. So
that's interesting. How long have you been a vegetarian?
About 22 years.
Wow,
22.
Since college.
Wow.
Yeah.
Usually
Half
people
my
always
life,
say 2 years, 3,
Yeah.
but 22. Wow.
Yeah, I got into it in
Alrighty.
college, and I just stayed with it, and I feel much better, and I feel more energy. It may be in my head, but so what? I feel great. So
I tried it for
Yeah.
about 6 months.
okay.
I tried it
Oh,
for
you
about
got 6 months.
6 months. I tried it and
Well,
I got
it didn't
about a
work.
week. About a week.
in New York City, it's not so bad. We have so many food
Yeah, we
choices.
do.
You know, you can find a lot of different ethnic foods, et cetera, that work well with that. Maybe, if we lived in Iowa, it'd be a lot tougher with
Oh,
the
you
steak and
know what I'm saying?
potatoes. But it's
Sounds really great about right now.
Gotcha.
So let's talk about some heart conditions that you commonly see at Harlem Hospital.
Okay. I think people hear heart attacks and they want to know maybe what a heart attack is. I think it's worth explaining what that is. Heart attack is when there's a sudden loss of blood supply to your heart, and it's an emergency when it happens. People can have small heart attacks, they can have large heart attacks, and how they present may depend on that. They may have very mild symptoms. They may have chest pressure or pain. Sometimes we don't say pain because the patient will come in and say, "Oh no, doc, I don't have any pain, but it feels like somebody's squeezing my chest." So they themselves describe it as a discomfort. So they may have chest discomfort. Classically, they get sweaty when they feel it. Classically, the symptoms will be worse when they're moving around, climbing stairs, walking around. They may get short of breath with it. If it's a very small heart attack, the symptoms may be subtle. If it's a bigger heart attack, the symptoms may be more dramatic, where they feel like they can't move around. Or if it's really dramatic, the patient can just collapse and, even die outside the hospital. We call that sudden cardiac death. So, obviously we want to work to prevent those. But that's a common cardiac condition. It's still very common. Controlling for risk factors. I think at Harlem Hospital, when we see smokers, when we see people with heart attacks come in, most of them I find are smokers, and most of them have cholesterol that hasn't been properly treated. So it's almost a shame in my mind. I feel like, if they had come to our attention sooner, we could have prevented it. Not every heart attack is preventable, but most of them, I would say, are preventable.
So I got a question about another myth and misconception.
Sure.
Myth versus fact. Is that when you're about to have a heart attack, pop a aspirin? Is that a fact or is that a myth?
That's true. That's a fact. You should probably chew the aspirin. Aspirin is antiplatelet. It thins your blood a little bit. And it's a little tiny pill, but it really does wonders for people who are actually having a heart attack or have vascular disease. So that's a true statement there.
Gotcha,
So, yeah.
gotcha. So it's 7:13. I always like staying the time before the commercial for some reason. But anyhow, 7:13.
Wait, that means we have 2 more minutes, right?
Well, actually, it's 7:14 now.
Oh, darn.
And by the time you ask the question, it's going to be 7:15.
Okay.
Let's just go
Doing
to
a
commercial.
Okay.
You're listening to Health in Harlem on WHCR 90.3 FM, the voice of Harlem. We're going to take a very quick break. So if you have any questions, comments, concerns, or just want to give us a quick shout out, hit us off at 212-650-6903. That's 212-650-6903. Going to take a quick break, and we will be right back.
WHCR 90.3 FM, New York.
You are a waste, a loser. Everyone hates you. Why don't you just stay in your car and keep driving? I'm serious. Drive until you run out of gas, then get out of your car and walk until you find someone who doesn't think you're dumber than bricks. Could take a while, but at least all that walking might burn a couple of calories.
You may not witness bullying like this every day. Your kids do. They want to help, but they don't know how. Visit stopbullying.gov to learn safe, simple ways your child can help stop bullying. Be more than a bystander at stopbullying.gov. A message from the Ad Council.
CNN.com recently named New York City as the most stressful city in the United States because of the high cost of living, long commutes, and overcrowded conditions. Some New Yorkers combat stress with exercise and fun activities in Central Park. But if stress has become too overwhelming for you to cope with, there is help. Harlem Hospital has an outpatient clinic that can help you deal with stress, alcoholism, anger management, and substance abuse. Seminars and workshops are held at Harlem Hospital on West 137th Street between Lenox and Fifth Avenues on the 4th floor. Workshops are held Monday through Friday from 9 a.m. to noon. Call 212-939-3210 for more information.
WHCR 90.3 FM, New York.
Good evening, ladies and gentlemen of the listening audience. This is Sean Shivers, and you're listening to Health in Harlem on WHCR 90.3 FM, the voice of Harlem. And our guest tonight is Dr. Damian Korean, and he is the Chief of Cardiology at Harlem Hospital Center. And our topic is myths and misconceptions about heart disease. And before we get started, we do have a caller on the line. Caller, can you hear us?
Yes, I can.
How you doing? Can you please let us know what your name is and where you're calling from?
I'm Sam from Harlem.
How you doing? Sam?
Yes.
How you doing, Sam?
How are you, Sam?
And you have a question for the doctor?
Yes. You made a comment about cholesterol.
Yes, sir.
They've done studies to find out that, first of all, your brain is 100% cholesterol, and every cell in your body is cholesterol. And usually when people say that you have clogged arteries and stuff, this is from scar tissue, is it not? Instead
That's
of
correct.
The cholesterol?
Yeah, well, your point is all the cells in our body are part cholesterol. So we need some cholesterol. But really it's been shown of study after study after study, the lower your cholesterol that we measure in your blood, the less your risk of having a heart attack or stroke. So yes, you do need some cholesterol, and it comes in a lot of foods, but too much of it, which comes from fat in your diet, saturated fat, is clearly bad for you.
But you have people in the Inuit community, like what we call Eskimos, they eat nothing but whale blubber, yet they don't have any heart attacks or high cholesterol like we do over here. So,
no, absolutely. It's not. That's a fantastic point, and there are genetic factors that cover for those things. They don't smoke as much as we do, as I understand. They don't live as long as we do, but you're absolutely right. So it's not a absolute given that if you eat poorly, you're going to have a heart attack. So there are genetic factors. If those people have some sort of genetic factors that protect their arteries and move the fat to where they need it and not into their blood vessels, because maybe it's cold up there and the fat gets moved into under their skin where they need it to keep warm and not into their blood vessels, then that may be a factor. There's parts we don't understand, but
okay, but does affect also that your liver will release cholesterol when you have infections in the body also.
yes.
And then once the infection is subsided, then the liver will stop releasing cholesterol.
Yeah, well, your liver makes the cholesterol in your body.
Exactly,
So.
but it also has the sense to release cholesterol when needed.
Mm-hmm.
So it's not going to keep pumping out cholesterol into your blood if you don't have infections inside the body.
Well, it will sometimes. So if you eat too much stuff that is loaded with high saturated fat, then you're sort of overloading the liver, so to speak, and it'll start spitting out too much cholesterol, to think of it simplistically, and it has to go somewhere, so it'll deposit into your blood vessels and cause plaques, which can cause all kinds of problems. So
And
I'm
sorry.
No,
And
it's
that's
okay.
where you're going to get the scar tissue. I mean, there's different
Correct.
types. There's different types of cholesterol. There's good cholesterol and there's bad cholesterol.
Yes.
The type that you want to stay away from is LDL. So when they do check your cholesterol, there's a certain level of LDL that you see, and you're like, okay, well, this is not so good, and you want to try to lower that.
Absolutely.
HDL is
My mother she was seeing a doctor, and the doctor told her that she had high cholesterol, and the doctor put her on medication to, quote, control it, and it wound up destroying her liver.
Well, it is.
Because the medicine was pinpointed to actually stop the liver from producing cholesterol.
Yes.
Right, so
And in fact, she had
Every medicine has a potential side effect, and if you
All
do
side
see
effects.
somebody and we put you on a medication, it's something that we have to monitor in people and discuss with you about the risks and benefits. So.
Gotcha. And Sam, we thank you for calling. I appreciate it. You have to finish the show, but tune in. Thank you. And Dr. Korean, I thank you very much. And Sam, we thank you for calling. So let's move on. So what's the next?
That's okay.
That's all right.
I think the cholesterol thing is important. We were talking about plaque buildup.
Comorbidities.
Yes. I mean,
stuff
how
like
do you
that.
know if you have these plaque buildup things? Usually, when you talk to your doctor, they look at all these risk factors. We
Right.
talked about some of them: diabetes, smoking, high blood pressure, your cholesterol level in your blood. Some of these factors you have no idea what they are unless you have them checked.
Right.
Being obese is an independent risk factor. Not moving around, not exercising is an independent risk factor. And then if these plaques build up very severe, you can have a heart attack. But even if they build up and they're not quite so severe where they're actually completely blocking an artery, they may cause some symptoms. We were talking just in the break about like having anginal attacks type things. So
Right. So can you just elaborate about angina?
yeah, sure. So angina is when you have a narrowing of your blood arteries to the heart. Doesn't completely block the artery where it causes a heart attack, but it's a narrowing where blood supply is not so good, and particularly during exercise when people are moving around, people climb stairs, they may feel those same types of symptoms we were talking about with a heart attack. So heaviness in the chest, sweatiness when climbing stairs, trouble breathing, lightheadedness with exertion can be a sign of an anginal attack and maybe needs further evaluation.
Right.
So the question.
No, I'm sorry.
Okay.
Okay. I think the unstable angina, where the plaque is able to move and then lodge into some other artery, you can
Yeah.
have like a PE, a pulmonary embolism, or
Sure.
like something like that.
Yeah, so you can have a clot anywhere in your body. Unfortunately, depends on where it goes, what the symptoms will be like. If it goes up to your brain, you have a stroke. It's in your heart, you have a heart attack. If it does go in your pulmonary circulation, you have what's called a pulmonary embolism. So, our mission is really to try to prevent these things
Right,
from happening in
absolutely.
as many people as possible.
So the question I have for you is that there's something I'm here reading. It's a small heart attack versus a severe heart attack, and it's saying that the myth is small heart attacks are no big deal. First of all, I think any heart attack is a big deal.
Yeah.
But what is a small heart attack?
Well, a small heart attack is a blockage that occurs in a branch artery of the coronary tree, so it doesn't cause that much damage to the heart. And as we mentioned before, the symptoms may not be so severe or dramatic, but mild. But absolutely, you said it right, John. Any heart attack is a serious heart attack because not that little heart attack may have caused the damage, but that little heart attack may be the warning sign of a big one to come. So, my dad always says there's no such thing as minor surgery. Every surgery is major. Same thing with heart attack. There's no such thing as a minor heart attack, really. They're all major events.
So you could have answered this earlier, but if you did, I want you to repeat it again. At what point should you go to the emergency room? Because I know, especially in this community, a lot of individuals may have those signs and may have those symptoms, and they're like, okay, I'm going to just sit and let me catch my breath, or let me just
Sure.
lay down. So at what point should you get up and go, or get up and
Or
go?
call 911.
Yes.
Yeah. I mean, if the symptoms are severe, you should activate 911 and come in. It's difficult. You're asking a great question because on one hand, we don't want people to sort of stay at home with something real going on, and they could maybe get early treatment, which could help them. On the other hand, we do have a lot of people who come in with very mild symptoms, and it's something that we feel like maybe could have been handled with a phone call to the doctor the next day. I think if you have doubt, come in. What's the worst thing that's
Yeah.
going to happen? We'll check you out quickly. We'll do an EKG, maybe run some little tests, and if it seems to be nothing, we'll just get you out of there. So the worst thing is you wasted some time. But so if you have doubt, come in. We are trying to very much to open up access to care to all of our residents. You touched on coming into the emergency room. We would like patients, people in the community to come in to see us, primary care and cardiology, and make a connection with a doctor, a healthcare provider with us, so maybe they can call us instead of thinking that they have to go to the emergency room right away for any type of symptoms. So we have a fair number of patients who call regularly if they feel something. It's really kind of the best way to take care of patients.
Now, I know at Harlem Hospital Center they have a program called Project Red. Project Red. Can you tell us a little bit about that program?
Yeah, sure. So that's really something nationwide going on. Patients who have heart failure, where your heart doesn't work so well, they need to be identified, and they really need targeted care, because we've found that when they get discharged from the hospital, they get readmitted at an incredible rate. About a third of them get readmitted, 25% to a third of them get readmitted to the hospital within 1 month. So that is, just shocking to me and a lot of people. So we try to target those patients who do have heart failure, find out what they need when they leave the hospital too, give them contact information where they can call us if anything's going on or they're confused about anything, and then try to see them early, usually in a week after they leave the hospital, to prevent that early readmission type thing. So
Correct.
It's a concerted effort by a lot of people in the hospital.
Correct. And also, too, the Center of CMS, Center of Medicaid and Medicaid Services, and this is fairly, the whole Obamacare is that if an individual is readmitted to the hospital more than once or even twice,
Yes.
The government will not reimburse you.
Yeah, so there's...
So basically, it's that get it right the first time.
Absolutely. It's not just, as you said, not just a quality thing. There's financial incentives
Correct.
for these institutions, and Harlem Hospital is very keen on that, and, we're working hard on those things.
Gotcha.
So we spoke about MI, we spoke about angina. So I do want to talk about a couple other things. So I want to get to vascular disease, but we did just talk about heart failure. So I know that there's two types of heart failure. There's systolic heart failure and diastolic. Am I right? Yeah.
Absolutely,
Okay.
yeah.
So can you just go into
You've
those
been
a little
reading a
bit?
lot. Yeah,
I
okay.
try.
Yeah, so heart failure is sort of a condition where your heart is not working well enough to provide oxygenated blood for your body. The symptoms can be, kind of nonspecific. You feel a little short of breath. You don't have energy. You feel fatigue. You don't sleep well. Systolic heart failure means the pump function is not good and it's not ejecting enough blood. Diastolic means it's not filling properly and the heart is stiffened. That's usually due to high blood pressure. 90+% of the time is what causes that. They sort of interact together. Some people have both kinds together. They're treated the same. It's about 50-50. If we see 100 people with heart failure, 50 have systolic, 50 have diastolic, and there are medications that help for both of them. So it's very important to identify those people who have heart failure and, as we talked about, get them targeted therapy and additional, support and visits. So.
Alrighty.
And we do have a caller on the air.
All right.
And we do have a caller on the air. Caller, can you hear us?
Yes, I can.
Yes,
can you hear me?
Yes, can you please let us know what your name is and where you're calling from?
Okay, this is Terrence calling from Harlem, the village of Harlem.
How you doing, Terrence? And Terrence, what's your question?
I actually attended City College myself. So.
All right.
Excellent. So, and what's your question for the doctor?
Okay, well, first of all, good evening to all.
Thank you.
And my question is that I understand that the Japanese actually smoke more than Americans. However, they're not coming down with the same rates of cancer and heart disease, and it's believed that it's because of their consumption of large amounts of green tea. Do you know anything about that? And if so, can you please speak on that? Thank you. I'll listen off the air.
Thank you, sir.
Absolutely, Terrence. Great questions with different ethnic groups and different prevalences of disease. The Japanese, to my knowledge, the Japanese do not smoke more than Americans say. The diet is very different. They do not eat a lot of saturated fat. I can't remember seeing any cheesy stuff in a Japanese restaurant.
And they eat correct portions
Yes,
also, too.
yes, they eat a lot of fish. That type of fat may be protective to the heart. They exercise a little bit more. Rates of obesity are less. So it is a complicated answer. In terms of the cancer thing, I really can't speak to. In terms of the vascular disease, I think their cholesterol levels as a whole are less. The bad cholesterol is less, but I think it mainly relates, Terrence, to the dietary differences. So even if you're correct about that smoking thing, and I had not heard that, but there are different factors which contribute. So the high blood pressure, the diabetes, the cholesterol, the obesity, if those factors are less, but the person still smokes, then the additive effects of all may be just less vascular disease.
And you heard it straight from the doctor's mouth.
Sure did.
You're listening to Health in Harlem on WHCR 90.3 FM, the voice of Harlem. We're going to take a quick break, but once again, if you want to give us a quick shout out, questions, comments, or concerns, hit us off 212-650-6903. That's 212-650-6903. We're going to take a quick break, and we'll be right back.
WHCR 90.3 FM, New York.
It's not always easy being a dad.
When's the fairy princess coming?
Any minute now.
What? What do you mean she's not coming?
But it's always worth it.
It's the fairy princess!
It is I, Grooves Zinkerbell. The smallest moments can have the biggest impact on a child's life.
I know it's really you, Drew. I'm just pretending for the other kids.
Take time to be a dad today. Call 877-4DAD-411 or visit fatherhood.gov. Brought to you by the U.S. Department of Health and Human Services and the Ad Council.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM, New York.
Because of foolish pride, but pain is a sickness that is hard to cover, and it's the reason.
Good evening once again, ladies and gentlemen. This is Sean Shivers.
And this is Ayana Cole.
I'm sorry about that. I forgot it last time.
That's okay.
And you're listening to Health in Harlem on WHCR 90.3 FM, New York, the voice of Harlem. And we have our guest tonight, Dr. James Korean. He is the chief of cardiology at Harlem Hospital Center. And our topic tonight is myths and misconceptions about heart disease. And before we get back into this interesting topic, Ayana, you have an announcement.
Oh, yes, I do. Almost forgot there. Okay, well, you all know every week Harlem Hospital Center's Farmers Market every Friday, 8 a.m. to 7 p.m. on Lenox Avenue between 135th and 137th Street. So come out, get your fresh honey that I like to say because Maurice told me about it. I still haven't gotten it, but I'm going to go. Your vegetables, your fruit. A whole bunch of nice organic products are there, all for you. They accept WIC, FMNP, it's my favorite one. Senior FMNP, Health Bucks, SNAP, EBT, debit, credit, cash. You might even be able to barter with them. You never know.
You never know. So, like, instead of going to the corner bodega, I want you to go in front of Harlem Hospital Center.
And I just want to say is, you know, this has been going on for a couple of years, but they used to kind of just be there when the weather was warm and nice, but now they're going year round, and they're out there in the cold and the snow even. So, you know, we try to support them as best we can.
Come on out, take advantage.
Definitely.
All right, so we're going to jump right back into the topic. Ms. Cole, give us a question, please.
Okay, well, so we talked about heart attacks, talked about angina, we talked about high cholesterol. We talked about one more thing I can't really remember, but we talked about something else. I wanted to get into valvular diseases.
Sure. So, you know, the heart muscle has 4 valves, and they work to prevent blood from going backwards in the heart. Blood goes in one direction, of course. So if those valves start to break down, which can happen over time or sometimes actually, the original topic for tonight, we were talking about congenital heart disease. So it could be something that someone is born with and a slight structural defect in the valve, and it leads to a malfunction of the valve. That could become a serious problem over time. It could lead to heart failure over time. And if we can identify them early, we can really help those people. they may present with symptoms of heart failure, trouble breathing, but we would like to identify people who have these things even before they have symptoms. So that could be picked up just on the physical exam. So you come see the doctor, your healthcare provider. We hear a murmur, which means an extra heart sound, and it may be suggestive to us. May be suggestive to us of a heart valve problem, and then we can get a quick ultrasound test. We call that an echo, and tell us what's going on.
So Dr. Coran, you are a very popular person right now. We have another caller on the line. Caller, what is your name and where you calling from? Caller, you're there?
Hello?
Hello? Caller, are you there?
Hello.
Yes, can you hear me?
I can hear you now. What is your name and where you calling from?
Okay, this is Charlie from Harlem.
How you doing, Charlie? And what's your question for the doctor?
Okay, listen, if you have a small heart murmur like I do,
Yes.
and I'd like to know how dangerous is that there, and, what should I do?
These questions are great questions. Great question, Charlie. Most murmurs are actually completely benign, meaning they're not dangerous to you. I would suggest that you have a doctor or your doctor assess the murmur, listen to it. If there's any doubt about it, we order that ultrasound test. It's called an echo, and the echo will look at all 4 of your heart valves closely and make sure that the murmur is not due to a serious valve malfunction. So you can ask your doctor about getting that test echo. It's very easy. We do thousands of them a year at Harlem Hospital. There's no radiation. It's an ultrasound test. It takes about 20 minutes. So I would suggest you maybe bring that up with your doctor if you've never had one before.
No, I haven't.
Very well. Thank you, Charlie. Thank you for calling. I appreciate it.
Thank you.
You're welcome.
You're welcome.
Information.
Yep.
All right.
And just to mention about the heart murmur. Did the call drop? Oop. Yes, mention about heart murmur. I had a heart murmur when I was about, I think it was like 12, 13. And I know every time I had to go to the doctor, go to the dentist.
Yeah.
I had to take an aspirin. And then I think when I hit 20, it disappeared.
They said that's it?
Yeah, that was it.
We used to be more loose about giving people medicines before they go to the dentist because it was assumed that a lot of these murmurs meant there was a valve problem, so we gave people medications to prevent a further problem with the valves. When people go to the dentist, there's cleaning the teeth, bacteria swim around the blood. We're trying to prevent those, but they've recently updated those guidelines. So most people with murmurs, first of all, again, most people with murmurs have nothing wrong with their heart valves. They're just little flow murmurs, we call them. But if there is a serious problem, we can find it out with the echo and then decide whether you need to take a specific medicine before going to the dentist.
Got you. So you have a question?
Yeah, but if you do, you can go ahead.
No, I have another myth and misconception.
No fight,
Well, you use your myth and misconception.
Okay, my myth. Now, looking on here, it says that when you have heart disease, that you need to take it very, very easy. Is that a fact or is that a myth?
That's a myth. And there are rare times where we really tell patients to take it easy. I think in the old days when people had heart attacks, they actually were treated with bed rest for weeks, 6 weeks at a time, and we really look back and laugh at that now. Now after a heart attack, we get people up and out. They're out of the hospital in 2 or 3 days, and really the more activity, the better. We learn that even with major heart disease, within reason, people push themselves a little bit. They have to see the doctor frequently, but rarely do we tell somebody to take it easy. We want people to sort of push themselves within reason. So myth to that one.
All right. Well, I just wanted to get into, there's one on the list, medications are bad. So I know there's like tons of medications for cardiovascular issues.
Yeah, I mean, there's so many medications, even blood pressure medications.
Right.
Last count, there's 140 of them. You count all the combinations.
Wow.
Cholesterol pills, there's a bunch of them. I think that every medicine, as we talked about, has a side effect potentially. It's a risk-benefit issue. It should be something, if your doctor or healthcare provider wants to start you on a medicine, you should fully understand why they want to start you on the medicine. What's the risk-benefit? Is there an alternative? Can you modify your lifestyle in some way instead of taking the medication? But I will tell you this. The cholesterol medications out there now, those statin medicines we call them, I really use the term, and I wrote it down, they're magic. They're magic pills. They prevent heart attacks, they prevent strokes, and they prevent deaths. And in high-risk patients, we really try to promote people to take those medicines. There are risks from taking them. They're very small. They're usually completely benign, meaning not dangerous to your life. Every patient is different, and we have to individualize things, but it's, again, a discussion you can have with your doctor, a healthcare provider about that. But for the statins, for sure, I'm here to recommend.
Well, I'm going to go into, again, another myth. In fact, it says that you can lower your chances of heart disease through vitamins and supplements. Is that a fact or is that a myth?
I'm going to take in between there. It's probably more myth, and I hate to say that because I think doing alternative type things and healthy type things can help you. Taking a particular supplement doesn't really prevent heart disease, I'll say that. Lifestyle changes clearly can prevent heart disease, but they've done studies in particular vitamins, vitamin E, vitamin B, and actually had negative effects on heart disease. So I'll lean towards calling that one a myth, Sean.
Okay.
All right. Cool. Okay, Sean. All right, throw me under the bus. I'm kidding.
Well, you were talking about PAD.
True.
Should we bring it up?
Yeah. Sure.
I think it's important. PAD is a term you may see. It's a abbreviation for peripheral arterial disease, and that peripheral means any artery that's not connected to your heart. So, why that's important is because anyone with peripheral arterial disease likely, almost certainly, has coronary heart disease. So if we can identify somebody who has a blockage in an artery, say in their leg, we know they have blockages of the arteries of the heart, and we can target some, increased therapy for them. Patients may present with cramping in their legs, just fatigue in the legs, loss of power in the legs, and some patients, I have it in one of my myths list here, they say, well, I'm getting older, or it's just my arthritis or something, and it may be, but we should check you out. There's a very easy, non-invasive test to check that out. We do at Harlem Hospital. It's called the ABI test, where we just measure the blood pressure between your legs and the arms. They should be about equal. If the blood pressure is lower in your legs, it's a strong suspicion to us you have a blockage somewhere, and we may need to investigate that further.
All right.
And doctor, you have another caller. Caller, what is your name and where you calling from?
Hi, this is Nancy calling from Brooklyn.
Hey, Nancy, how you doing? And what is your question for the?
Fine, and you?
And what's the question for the doctor?
First of all, I want to thank you, doctor, for this fantastic discussion.
Nancy, you're very welcome.
This topic is excellent.
Thank you so much.
There are so many myths and misconceptions about heart disease. And one I wanted to ask about was particularly for women.
Yes.
I understand some of the I didn't get a chance to hear some of the conversation earlier because my computer was acting up and I wasn't able to live stream, but I didn't know if you touched on some of the myths of the signs and symptoms that women go through versus men.
That's a fantastic question again, Nancy. We didn't touch on that yet, so I guess it's a great time to talk about it. The dusty old textbooks only had done studies on men in terms of how they present. And we know women do present differently with heart disease, with angina and heart attacks. Less classically would be that heaviness in the middle of the chest, radiates up to your neck or left shoulder, sweatiness, difficulty breathing. Women less likely have that. They may just have a different type of chest pain. It may be lower in the chest, and they may feel it more in the abdomen. It may be just in the neck or just in the shoulders, in both shoulders, left and right shoulder. But I do want to make that point again. Men, women, young, old, when you're thinking about an anginal attack or a blockage of an artery, the symptoms have to be worse with exertion. Now, you can have a heart attack anytime just sitting there, but for anginal attacks or worrying about the heart, the symptoms have to be worse with exertion. So a typical female with an anginal attack may have bilateral shoulder pain with sweatiness, different from what it says in the dusty old textbooks. However, they will say that their symptoms are worse when they climb stairs. They're worse when they climb a hill or taking a long walk. So that's pretty consistent with everybody.
Oh, okay.
And thank you, Nancy, for calling in. We appreciate you always calling in.
Thank you so much.
You're welcome.
Thank you, Nancy.
And I want to read on here. This is from the Myths and Misconceptions. It says, is heart disease really a man's problem? And it says no. And you can correct me if I'm wrong. It says since 1984, more women than men have died each year from heart disease. Heart disease is a leading cause of death in women over the age of 65.
Oh, absolutely. And you know, that's a number one myth right there. So that's multifactorial. What Nancy was talking about, the symptoms are a little bit different, so we tend to diagnose women with heart disease later. Their symptoms may have been dismissed and said, oh, you just have acid reflux or something. Women do tend to present at a little bit older age than men with heart disease, so that kind of confounds things a little bit. But women smoke just as much as men. Women have some of those same risk factors we were talking about, again, diabetes, high blood pressure, cholesterol, being obese, not moving around so much, so just like men. So their risks of dying are just the same. Heart disease, number one killer in the United States, both men and women. So definitely men.
WHCR 90.3 FM, New York.
All right, so we're going to take our last break for the evening?
No, actually, let's jump right in.
Oh, okay. All right. Well, okay, so a lot of people talk about getting bypass surgery. I feel like that's such a common, not a common thing to happen, but a common thing for people to talk about whenever they discuss heart disease and heart surgeries. It's always bypass. So can you just explain what bypass surgery is, and after bypass surgery, how likely are you to have better symptoms? I know it's just a temporary fix, but how likely are you to progress?
Absolutely, great question. You guys, no easy questions that I have from you guys. But so bypass surgery or stenting, revascularization, we reserve for people who have such severe blockages that we mechanically have to do something, and medication alone is not working. If we can do it with a catheter through the vein endovascularly, means we put little tubes in, blow up a balloon, move the plaque out of the way, put a little metal cage in there. That's called a stent. That's one way to handle it. If the blockages are so severe, like they're in all the arteries of the heart, you have 3 major arteries of the heart. If all 3 have severe blockages, typically we will refer them for bypass. So I like to explain that as like detours to the streets of your body. There's blockages there, so we have to create new streets around there. So a surgeon does that, not a cardiologist. It's typically done as an open heart procedure, mean the patient is completely under general anesthesia. They have their chest opened up, and they find new arteries to use to detour those arteries. So they use arteries from the chest. They can take veins out of the legs, and they create new problems. And it's great you brought that up. As a controversy is people, I find, feel like they've been fixed after they had that done. But it's really, I almost want to use the term palliative. It eliminates the symptoms, but it doesn't get to the root of the problem. The root of the problem is what caused those plaques to build up in the first place. So to answer your question specifically, what is the likelihood of the patient coming back again? I think it has to do with after a bypass, after a stent is put in, are they controlling those risk factors that we talked about? If they are controlling them, it's very unlikely they'll come back again. But if they continue to smoke, the diabetes is out of control, we're probably going to see them back again. They'll need another procedure if they make it to that.
Right. So those people who come back and they get like triple bypass surgeries and like quadruple bypass surgeries, what is the limit to like continuously fixing them?
They could probably do surgery 2 times, and then you run out of blood vessels.
Right.
But we can, so absolutely, your body only has so many blood vessels. But we can go in there and balloon open things and stent open things.
Wow.
Indefinitely almost. So even after bypass, we can go in there and stent open arteries, but there can be a limit.
It's difficult, you know. Like, why would you want to continuously put your body through that? Just try to do better, you know.
Can't imagine.
Smoke,
yes,
better.
Absolutely.
All right, we got another caller.
Yes, we do. And sir, I know you're hitting the mark. This is the most. Hello, sir. How you doing? What is your name? Where you calling from?
Yes, my name is Brother Barry from Harlem. I hear the doctor making mentions of certain steps dealing with heart attacks, but my 2 questions is, one, why is it that when people go to the doctor and they have all these pills, one, they're not finding out if the person that's taking these pills is that their blood type is conducive to what they're taking? And two, why is it that the holistic approach is not being used? There are some hospitals are using it, but most of them are not.
Great question. In terms of the first part, what pills are you taking? What is it? We encourage patients when we first meet them, bring in all your pills. Let's take a bag of pills. Let's see what you're taking. Let's go over them one by one. We'll tell you why you're taking that medicine and whether you need to continue that. And patients feel sometimes, I get put on a medicine, I got to take it the rest of my life. Not at all. We can drop things from your regimen if we feel it's not doing things for you. So, yeah, we review all your medications, and each pill you take should be understood as why you're taking it and what the risks and benefits are. In terms of a connection to blood type, I have to challenge that, Reverend. I don't know necessarily how your blood type relates to your response to certain medications. I'm not familiar with that, so I will challenge that a little bit. The second part of your question about holistic, the short answer is, I'll tell you what, most doctors were not properly trained in holistic medicine. And we go through medical school, and we have very limited lectures and lessons about that stuff. It's true. Very, very important. You can speak to this, Anna. Very, very important. I think we're learning more. I encourage patients to read about holistic things and learn about it. We try to be progressive at Harlem Hospital in learning about holistic things and treatments and recommend them. And look, it's an agreement between the patient and the doctor when we meet them. I have a lot of patients who say, I'm not a pill person. First of all, I always say, well, who is really a pill person? But patients are really, I don't want to take this. Is there anything else you can offer? And we can talk about some holistic things that can help them for just about any condition. The short answer, again, is we don't have a lot of training about it. There's not a lot of good studies on holistic things because they don't have the backing of these pharmaceutical companies to show a definite benefit. So they're smaller studies, but great point. It's just something that has to be individualized between the doctor and the patient, Reverend.
Sir, thank you very much for calling on the air. We greatly appreciate it.
All right. Thank you.
You're welcome.
All right. So speaking of Harlem Hospital specifically, so if let's say that I have, or I believe that I have a heart condition.
Sure.
So I come in, where exactly do I go? What number do I call?
All right.
Actually, what happens during that first initial assessment?
Right.
Yeah, so we see, let me give you the number real quick before I get 212-939-4700.
And say that one more time for us.
212-939-4700. We kind of created a direct line to the Division of Cardiology at Harlem Hospital. We can get you hooked up in the clinic, or if you need any heart tests that your primary care doctor wanted. So I hope Lizzie and Harriet, you're listening here, the phone's going to be ringing off the hook tomorrow. So we can bring you in. A lot of patients we see in cardiology clinic are primary care type patients, so they may be coming for an initial visit. And a lot of patients in Harlem, East and Central Harlem, are just looking to make a connection with a doctor, and we welcome those type of patients. We will talk to the patients about risk factors, kind of assess what's going on. If they do have a particular complaint, we can talk to them a little more, take a good history, which just means talking to them, physical exam, and then see if any tests are necessary.
Alrighty. Wow, we have one more caller, number 6. Okay.
Caller, you there?
Yes, I am.
Yes, and what is your name and where you calling from, sir?
Okay, George, I'm calling from the Bronx. I want to know about gout, and can I get a number and I can come make an appointment? I heard you mention about gout, and I just experienced something recently in the past 3 days, actually. I went to Harlem Hospital just yesterday.
Okay.
And they gave me a shot for pain. It works, but of course it wears off eventually.
Yeah,
so when you mentioned gout, it struck a chord with me.
I will tell you,
I'm dealing with that right now.
George, gout is an arthritis problem, not particular with the heart, but that number I gave you, 212-939.
Wait a minute. I'm writing it down. Wait a minute.
Okay, got you. Grab that pen. Grab that pen.
212-939-4700.
Okay.
You call us tomorrow, and I'm going to connect you to the gout specialist we have
Okay,
at
what's your
Harlem
name?
Hospital. My name is Korean.
Dr. Korean.
Yes.
Dr. Korean, thank you, sir.
You're very welcome,
Good
George.
show,
Well, thank you very much.
Thank you.
I hope you feel better from that.
God,
soon.
thank you, sir. God bless.
All right.
Thank you for calling in, sir.
Okay, wow, 6. That is a record.
Is
right.
it really?
It is. It is
Come
a
on.
record.
Yeah, 6 callers.
It's a record.
Wow.
Of different
Keep 'em coming.
voices.
We gotta bring you back, like ASAP, like in the next couple of weeks.
Thank you very much.
So, right now, we need to start wrapping up. Believe it or not, I didn't realize what time it was.
Me either.
So it's all good. So, a quick summary, Dr. Korean. Can you let the listening audience know, out of everything that you spoke about, give us at least 2 things that we should take out of this conversation?
Okay. Number 1, smoking.
I knew it.
Get rid of
knew
it.
it.
Get rid of it,
Correct.
and stay away from people who smoke too. By the way, we're pretty
Secondhand
sure
smoke, yeah.
secondhand smoke is maybe not as bad as smoking yourself, but it's clearly a risk factor. So come in, we'll help you. There's new therapies to get you off cigarettes, and so that's number 1. It's the number 1 preventable cause of heart disease in the United States, in Harlem, in Manhattan, New York. So that's number 1. Number 2, I think about coming in and just connecting with a healthcare specialist, a doctor. We touched on that symptoms people may feel may be mild, or they may not have any symptoms at all. Things like high blood pressure, cholesterol, there's really no symptoms from it. So you won't know unless you come in. I think people feel like, well, you know what, I feel fine, I'll wait till I feel something, or I'm too young, it's not ready for me to come in. Basically, we're looking for you once you're an adult, over age 18. You can come in, get a checkup. We'll be happy to talk to you. If there's not much to talk about, good. It's a quick visit in and out, but we'll be happy to talk to you, make a connection. I feel it's always better to get to know a doctor or a healthcare provider, somebody that you know, and then in the future, if you have any problems, you can call that person, connect with them. We try, really trying hard to do that at Harlem Hospital, connect with them, and it's a better relationship for the doctor and the patient. We know you, you know us. If you call us with something going on, I don't quite feel right, we know your history. So if you haven't seen a doctor in a long time, give us a call, give us a chance. We have a lot of great doctors at Harlem Hospital, and we're more than happy to help you.
And one thing I want to definitely say, when it comes to your primary care physician, you should trust that person, and you should be able to ask them any type of question. If your primary care physician, because there's too many out there, if they do not answer your questions, or they shrug, they kind of shrug you off when you ask them a question, it's time to find a new one. That is your right.
There's plenty out there.
Plenty.
Time to find a new one if you feel that way.
Shop around.
That is harsh, but it's true.
Shop around. But I will say, from my experience working and being at Harlem Hospital, the physicians there go out of their way to make you feel at home.
All right.
Correct.
That's a nice way to end it.
Yes, very much so. So,
next week?
Yes, Miss Cole, please let us know what's going on next week.
All right, so we're going to be talking about, you and Mo are going to be talking about children's dental care with Dr. James King.
Oh, Dr. King. I forgot. Dental month. Yeah, so we're going to have Mr. King on next month. And Next week. I said next month. Next week. I'm sorry. I want to give a quick shout out to my boy Mo, who's down at Downstate doing a double in the emergency department.
Dr. Selby.
Yes. Dr. Selby. He's down there fixing people. And I want to say again, thank you, Dr. Korean, for coming on to the show, giving excellent advice.
You're very welcome.
And actually, I'm going to put a 7 on the wall right there, because we had like 7 callers call in.
Okay.
That's the most that we had.
And Sean and Ayana, thank you so much. It was a lot of fun, and you guys make it very easy for me. So I really appreciate it.
No problem. And I want to give a quick shout out to my girl Valerie Wright and to my girl Nancy Simmons, because without them, we will not have great guests like Dr. Korean. And this show, as always, is dedicated in memory of Miss Gloria Thomas. Harlem, make sure you tune in next week. Harlem, thank you very much, and take care of yourself.
Whcr 90.3 FM, New York.
Wisdom and knowledge will guide you through. Don't you be the devil tool. No, you can't guide a people without a vision. You shall surely go astray. The Bible can teach you wisdom, whether you wife or you done.